Hey folks, in this video we're going to talk about Brodmann's areas. I'm excited. Are you excited? I'm very excited. Alrighty, so Brodmann's areas. Brodmann was an anatomist, and in 1907 he mapped out different areas of the brain. So he divided the surface of the cortex into 52 specific regions according to what their function is. And some of these are motor, some sensory, and some are what he calls association areas, kind of putting together a little bit of sensory and motor. And here is what it looks like. So these are Brodmann's areas. And on the test, I am going to want you to know the number, the name, and the function. And I will show you this image. So that will help a lot. So you don't have to just memorize number four. Number four, I'll tell you, that's the precentral gyrus, that's the primary motor cortex. But if this is right here in front of you with the numbers on it, it's easier to remember that. So Brodmann's area is mapped out 52 different brain regions, but we're updating this. We're learning much more about the brain. So 2016, they started the Human Connectome Project. And what they did, they had 1,200 volunteers, and they got an MRI, a really more functional MRI, and they detailed nearly 100 previously unknown regions. So I'm not going to have you learn 150 different regions of the brain. So isn't that nice of me? We're just going to focus on a few main ones. But we are learning more and more about the brain all the time. So here we go. Areas 1, 2, 3, right here. That's in the parietal lobe. That is the postcentral gyrus. This is the primary somatosensory area. And what I'm going to want you to know is the numbers, the name, what it does, and then what would happen if it was lesioned. So areas 3, 2, 1, it's primary somatosensory cortex, and that's going to be the recognition of pain, of sensation. So not just pain, so sensation, pressure, pain, touch, temperature, position, all those sensations of touch, those go right to areas 1, 2, 3. So if we were to lesion it, you couldn't feel. All right, so I put something in your hand and you wouldn't get a sense of pressure or temperature or touch or fuzzy or wet or pokey or whatever it feels like. So that is the primary somatosensory cortex. And related to that, areas 5, 7, you can see it's right next door to it and it's big. This is the somatosensory association cortex. And you're going to see a pattern when something gets an association cortex. Basically, it gives meaning to the touch. So if I wish I was in person with you. I wish we do things. All right, if I were to put a pencil in your hand, areas 1, 2, 3, you'd feel it, you feel, okay, it feels hard and it's round and there's these ridges and there's this pointy part, but area 5, 7 tells you it's a pencil. All right, so area 5, 7, the somatosensory association cortex, it puts meaning to what you just touched. So it's your ability to identify the object by touch. So areas 1, 2, 3, you feel that it's hard and round and pointy, and area 5, 7 tells you that that combination of feeling is a pencil. So if you had a lesion to area 5, 7, you'd still feel it, but you wouldn't know what it was. All right, so you couldn't tell what you're touching. And there is, in the last time we talked about the parietal lobe syndrome, that amorphosynthesis, and basically you don't recognize half of your body. You can, it's slightly different, but people with that, they don't recognize half the sensation from half their body, and they recognize like the left half of their body as being alien, and they'll try and throw the left half of their body out of bed. But anyway, so that's related to the parietal lobe as well. Area 4. That's the precentral gyrus. That's the primary motor cortex. And that is for voluntary initiation of movement. So if you have a lesion on, for instance, the left side of your primary motor cortex, you're going to have trouble. You're going to lose voluntary movements on the right side of your body. Now, it might be localized. It might be, just a little tiny lesion right here, which means you might lose motor activity in a specific part of the brain on the other side of the body. But primary motor cortex, area 4, that is initiation of voluntary movement. And it's contralateral. All right, so left brain controls voluntary movement on the right side of the body. Area 6, we'll talk about this more later in the semester, but this is the motor association cortex, and this is going to assist in movements. It's more for planning and anticipating movements. It's also for movements that you do a lot. So the first time you learn to type, you're very self-conscious and conscious of moving your fingers, but now you just, blah, 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 or playing the piano, your fingers just go. Or drive, oh, the cat did that. Hold on, let me find where we were. Okay. I can't move the cats. They insist. All right, where was I? So playing the piano or driving a car, it becomes kind of a motor habit. So planning, initiating, and executing these overlearned motor pathways. That's going to be the pre-motor cortex or the motor association cortex. And area 8, that's for voluntary eye movements. And we move our eyes, we have more eye muscles than other animals. So we can, I mean, cows don't roll their eyes at you, but we can do that to show how we're feeling about different things. All right. Areas 44 and 45 right here, that is Brokaw's area. And it's more on the left side. And this is also called the motor speech cortex. It's usually on the left, but not always. The motor speech cortex, it basically coordinates the muscular activities of your mouth and your tongue and your larynx in order to speak. So it's the verbalization of language. Now that's all we ever thought it was until 2009, and then it's more than that, okay? So in 2009 we found that it's not just the ability to speak, it's also understanding the meaning and the structure of words. It's also for understanding, but on a test. So we know it's more than this, but on a test, if I were to ask you, Brokaw's area, motor speech cortex, 44 and 45, it's the ability to coordinate the movement of your mouth and your throat in order to speak. So stuttering might be a lesion or damage or problems here in Brokaw's area. And one interesting thing, people with a stutter can sing. So if they're trying to say a word and they're stumbling and stuttering over their words, if you ask them to sing the same words, they can do it just fine because singing is more on the right hemisphere. So I find that very interesting. Now, if it's a full lesion, that's going to be motor aphasia. Then you just can't speak at all. You can understand language. You can understand written and spoken language, but you can't speak. And Brokaw was the doctor who had a patient who had that. And then he dissected his brain and found damage to his area. All right, areas 9, 10, 11, 12, 46, 47. Basically, I'm not going to ask you specific numbers, just call it the prefrontal cortex. And that is planning, reasoning, rational decision making, all those, the ability to act, react based on past situations and plan ahead, all those things. Now, this is so basic cognitive skills. And we're now dividing it, and there's different, this is a big chunk of tissue. And in this Connectome project, they're finding specific areas, and they all have specific, roles, but I'm not going to get into that. But I will mention that this area of the brain is the last to develop as you age. So it really is probably not completely developed till you're in your mid-20s. So this might be why teenagers don't always make the best decisions. The risky areas of your brain are developed and the emotional areas of the brain are developed first, but the area of the brain that says, no, don't do that, calm down, don't react like that, that isn't completely finished until mid-20s. All right. Oh, yep. So in the Connectome project, they did talk about the medial frontal, prefrontal, and dorsolateral prefrontal. And it's in your notes, but I'm not going to ask you specifically what these do. All right, where are we? Areas 41 and 42. That's right here. We're now into the temporal lobe. We were in the frontal lobe, now we're in the temporal lobe. Area 41 is the primary auditory cortex. So sounds go there. So I just heard or voice or whatever. So the sounds go to the primary auditory cortex. The secondary auditory cortex, that gives meaning to what you hear. So if you're driving along and you hear, I was about to do a European siren. Woo, ew, ew, ew. Now I can't think how American siren goes. Well, a siren. You hear a siren. All right. So Area 41 hears ew, ew, ew if you're in England. And Area 42 tells you, oh, shoot, I'm in trouble. It puts meaning to the sound. All right. So Area 42 has you react and puts meaning to the sound that you hear. So if you have a lesion there, you'll hear the sound, but you won't know what it means. Wernicke's area is number 22. I've lost it. Where is number 2? Right here, area 22. I was looking right at it. This is Wernicke's area, and it's sometimes called the sensory language area or the auditory association cortex. This is really important in language, all right, and understanding language. So if you have a lesion here in Wernicke's area, this one seems terrifying to me. You can hear just fine, but the words, it's just like gobbledygook. And when you speak, it's kind of gibberish. You'll say things like, Mama go banana to the work pants pantyhose. I don't know why those words, but that's what it's like. It's like word salad. So random string of words, you can speak, you can say words, but when you say them, they don't make sense. And when you hear words, the meaning, the understanding of what the words are doesn't come through. That's terrifying to me. So that is Wernicke's area. If there's a lesion, you can't understand what is written or what you hear. It's just gibberish. Area 17, here in the occipital lobes. This is going to be all vision. Area 17 is the primary visual cortex. So that is going to be where images go. And you have a lesion there, you're blind. Areas 18 and 19, those are the visual association cortices. So again, you already know what that kind of means. It puts meaning to what you see. So we're driving our car and you see the flashing red and blue lights behind you. Seeing those red and blue lights, that's area 17. Areas 18, 19 put meaning to it, like, oh dear, and you know you're in trouble. Okay, so it's going to put meaning to what you're seeing. It's associated with the visual memory and recognizing what you've seen. So a lesion there, you can see, but you don't really understand what you're seeing. And the cat just did that. All right, so let's move on. The kitty says it's time to move on. Areas 37, 39, and 40. Here we are. And you can see it's near the visual areas and it's near the language areas. So what 37, 39, and 40 are, that's the sensory association cortex. That's reading, all right, near vision and language. So it's the ability to read and comprehend what you are reading. So look, it requires the visual component and the verbal and the auditory components right there. And so if you have a lesion to the sensory association cortex, the reading area, you may have a reading disorder. Alexia is the complete inability to read. You can still understand written language. I'm sorry, understand spoken language, but you can't read. Dyslexia is difficulty in reading. And we're still trying to understand that. It may be due to one hemisphere being dominant over another, because people with dyslexia often have better spatial abilities. But we're still learning about that, but this is the area important for reading. All right, the next area. Yes, I put this up on purpose. So look at this, look at all the roses, and what I'm going to ask you to do, pick out this specific rose from what I've put up there. All right, you could do it. I found it. There it is. But it might have taken a while. But now look at this picture. This is me in the 80s, late 80s at least. This is my family back then. Now look at this one person. All right, you probably found right away that is my sister. But this picture was taken like 30 years later. And so Your brain can instantly recognize faces. We are good at faces. We have a big area of the brains, area 20 and 21, that is just for recognizing faces, because so much of what we do is important. It's important to recognize faces, to interact with the thousands of people we interact with. And when you think about how many thousands of people that, celebrities you see on TV, and people and you could recognize their face even decades later. This is my special talent. I'll tell you, it's my superhero power. I am really, really good at faces. And so we'll be watching TV and some random actor will pass by for a split second and I'll say, wait, he was in that episode of Three's Company in 1977 and he's 50 years older, but I could still recognize his face. I'm really good at faces, which is one of the reasons I miss seeing you in person, because I know who you were by faces. Anyway, so I'm going to show you some more faces. I just noticed the faces. Okay, what did you notice? You noticed in the spinach in the teeth, didn't you? Because we see that. We focus so much on faces. But did you notice that she has 6 fingers on her hand? All right, maybe you didn't notice that because we're looking too much at the spinach. Did you notice that? Where did that arm come from? That doesn't make any sense at all, but you didn't notice that. And you might not have noticed that he has no ear, because we look at faces. So where faces are, it's area 20 and 21, all right? And the inability to recognize faces is prosopagnosia. I believe Brad Pitt has it. And it can be difficult to have. And so you can see your own face, you can see your mother's face, and you don't recognize that face that you see all the time because you're just lacking the ability to recognize faces. So people with this learn to, identify by voice, or this person always wears this hat or something like that, but it can be quite difficult to not be able to recognize faces. So just a little more fun with faces. Here are some faces of people who are younger. Can you recognize who they are? All right. Helen Mirren, who's still a babe. What is she, 80 years old? And she looks freaking amazing. All right, who's this? Stephen Colbert. He was a hottie too. Ian McKellen. Can you get this one? He was so goofy. I love it. Steve Carell. Got this one? Bruce Willis. This one's funny. All right, he is greatly improved, but you can still see his face. Can you recognize who this one is? George Clooney. Face still looks the same. Betty White. And of all of them, I think he has changed the most. Ryan Seacrest. All right, the last thing I'll close it out with is, we are so in tuned to looking at faces. Can you tell from this image which one is sick? So can you tell? So think about it. And people, they're really pretty close, and with a computer, they made tiny, tiny manipulations. But the one on the left, did you get it? His lips are a little paler. His eyelids are a little droopier. He's a little paler skin in general, little watery eyes. But we are highly in tune to look at faces, and that would help to identify contagious diseases. So yeah, when we meet in Zoom, I have a game that I'm hoping we can play. It's a puzzle that you're going to create with the Brodmann's pieces, and we'll see how that works. So I will close this one out and see you later.